Good evening and welcome to Nurse Maureen's Health Show podcast. I'm Maureen McGrath, registered nurse, nurse continence advisor, sexual health educator, and sometimes they call me the vagina nurse. Yes, I see patients, women in my clinical practice who have vaginal health issues, and so I'm always interested in the latest study. But first and foremost, I would really like to ask you a little favor. If you feel like subscribing to my podcast, I would certainly love that. Hope you're doing well tonight. Hello, everyone, and welcome to my podcast. Tonight, we're discussing what I believe is one of the most important women's health studies published this year. It challenges how we think about vaginal estrogen and highlights something I've been saying for years, that treating the vagina isn't just about comfort, it's also about health. The study is entitled Vaginal Estrogen Prescription is Associated with Reduced Risk of Serious Adverse Outcomes in Women of All Age Groups with a Recurrent Urinary Tract Infection, an EPIC Cosmos database analysis. It was published in the journal Urology in June of this year. Let's break down what the researchers found and why every healthcare provider and every woman should know about it. First, let's talk about recurrent urinary tract infections. Most people think of a urinary tract infection or a UTI as an inconvenience, but recurrent UTIs are far more serious than many women and healthcare providers realize. Women who experience repeated infections have higher rates of emergency department visits, hospital admissions, kidney infections, sepsis, and even death. Yes, death. Yet many women are treated with antibiotic after antibiotic without anyone addressing why the infections keep happening. One of the most common reasons is estrogen deficiency. As estrogen levels fall, the tissues of the vagina, the urethra, and the bladder begin to thin. The vaginal pH becomes less acidic. Protective lactobacillus bacteria decline. And this allows bacteria like E. coli to colonize the urinary tract much more easily. This is one of the hallmarks of a condition I've talked about on this podcast many times in the past, genitourinary syndrome of menopause, or GSM. Fortunately, we have an effective treatment. Low-dose vaginal estrogen restores the health of the vaginal and urinary tissues, improves blood flow, thickens the tissue lining, restores the acidic environment, and encourages the return of healthy bacteria. Now let's look at this remarkable study. Researchers used the EPIC Cosmos database, one of the largest electronic health record databases in the world. They identified nearly 1.9 million women with recurrent urinary tract infections. Of those women, approximately 97,000 received a prescription for vaginal estrogen, while nearly 1.8 million did not. The researchers then followed these women for up to 8 years, and they looked at 3 major outcomes: sepsis, hospitalization, and all-cause mortality. And the results, too, were remarkable. Across every age group, from women aged 20 to 39, all the way through women in their 70s, 80s, and 90s, those prescribed vaginal estrogen had significantly lower rates of all 3 outcomes. Women receiving localized vaginal estrogen experienced lower rates of sepsis, lower rates of hospitalization, and lower rates of death. For example, mortality ranged from 0.25% to 3.9% among women prescribed vaginal estrogen, compared with 0.84% to 9.6% in women who were not prescribed it. The odds of death were reduced by roughly 60 to 80%, depending on the age group studied. Now, this is where we need to be careful. This study does not prove that vaginal estrogen itself prevents death. It was an observational database study. You may have seen something different or heard something different on social media, but what this shows is an association. But when nearly 2 million women are studied and every age group demonstrates the same consistent pattern, researchers pay attention. The findings are biologically plausible. We already know that vaginal estrogen reduces recurrent urinary tract infections, and fewer infections means fewer antibiotics. It also means less antibiotic resistance. It also means fewer trips to the emergency department and fewer hospital admissions. And that means fewer episodes of sepsis, which is an overwhelming infection. Those improvements can absolutely influence long term health. One of the most surprising findings, though, was that benefits weren't limited to older women. Women between the ages of 20 and 39 with recurrent UTIs also experienced lower rates of serious complications when prescribed vaginal estrogen. And that may surprise some of you, and it may surprise a lot of physicians as well, or healthcare providers. We often associate vaginal estrogen only with menopause, but younger women can experience low estrogen levels as well. During breastfeeding, after certain cancer treatments, with medications that suppress ovarian function, after pelvic radiation, and from some other medical conditions as well. So the message is simple. If estrogen deficiency is contributing to recurrent urinary tract infections, treating the underlying problem matters. And as someone who treats women every single week in my clinical practice and also educates healthcare providers about GSM and recurrent urinary tract infections and urinary incontinence and urgency, frequency, dryness, the whole bit, these findings resonate with what I see in my practice. I meet women who have suffered for years. So often I think to myself, how long, if I ask a patient, how long have you been on localized estrogen? They'll say 3 months or 2 years. They might be 80 or 90. And they'll say, I should have started maybe a couple of years ago. And I think, no, you should have started 30 years ago. I say that in my mind. It's so sad because there are also architectural changes that can occur to the labia and the clitoris and the folds. And so low dose localized estrogen is very important for a number of reasons, in addition to preventing death from recurrent urinary tract infections. But oftentimes, these women that I see in my clinical practice who've had recurrent urinary tract infections have been prescribed antibiotic after antibiotic, or they're on daily low dose antibiotics. And that can reduce sexual desire, amongst other things. Anyway, some have had dozens of UTIs. Others tell me they no longer travel because they're afraid of being far from a bathroom. Others travel with their antibiotics. Many have stopped exercising. They don't feel well. They're nervous about when the next UTI is going to happen. Many avoid intimacy because intercourse has become painful. I can't tell you how many women in their 50s, 60s, 70s say, no, I stopped that years ago. And when I probe a little bit further, it has to do with their vaginal dryness and painful sex or dyspareunia. Anyway, we diagnose genitourinary syndrome of menopause. We start with evidence-based treatment, and that often includes vaginal estrogen or a hormone-free personal moisturizer that has to go inside of your vagina, ladies. Don't fall for all these marketed creams that have been developed by marketing people who are just trying to capitalize on menopausal women. And right now in British Columbia, the government has approved a couple of that low-dose localized vaginal estrogen therapies like Premarin cream and Imvexxy. So talk to your doctor about it. But when these women are prescribed vaginal estrogen, their urinary symptoms improve and they optimize after about 2 to 3 months. Their recurrent urinary tract infections become less frequent or non-existent completely, and their confidence returns. Their quality of life changes dramatically. And this study reinforces that what happens in the vagina does not stay in the vagina. Healthy vaginal tissue supports healthy urinary tissue. Healthy urinary tissue helps prevent infections. And preventing infections can reduce hospitalization and potentially save lives. Another important point is safety. Low-dose vaginal estrogen is not the same as systemic hormone therapy often prescribed for vasomotor symptoms. The amount absorbed into the bloodstream is minimal when it's localized estrogen therapy. Major menopause and gynecology organizations continue to support its use for appropriately selected women because of its excellent safety profile. I've had patients who are physicians who have a history of breast cancer who are using low-dose localized estrogen therapy. It's pretty much safe for 99.9% of women. For some women, if they have too much estrogen in the vagina, they may get a yeast infection. That's really the only thing. But for the most part, unless a woman is not comfortable and you don't want to coerce anybody, there are other options like, as I mentioned, hormone-free personal moisturizers that can help to keep the tissues very healthy. Decisions for women with hormone-sensitive cancers, however, should always be individualized with their healthcare team. But sometimes the healthcare team isn't up to date. So just keep that in mind. But you can send studies to healthcare providers because they will read them and they will change their practice. I've seen it myself. My hope is that studies like this encourage more healthcare providers to ask women about bladder symptoms, vaginal dryness, painful intercourse, urgency, recurrent urinary tract infections, and all the symptoms that women are too often told are simply part of getting older. They are not. These symptoms are treatable, and you deserve to know that. This study also reminds us that women's health deserves the same level of research, attention, and urgency as every other area of medicine. Nearly 2 million women participated in this analysis through their healthcare records. Their data may help improve care for millions more. And I hope it's you. You're suffering with a recurrent urinary tract infection. Go speak to your healthcare provider. Have them listen to my podcast. Feel free to share this with somebody who you think might benefit. And thank you so much for tuning in to Nurse Maureen's Health Show podcast. If tonight's episode taught you something new, please subscribe, leave a review, and share this episode with a friend, colleague, or healthcare provider. Just tell them that you listen to the Vagina Nurse. Because when women understand their bodies and when clinicians practice evidence-based medicine, everyone benefits. Until next time, I'm Nurse Maureen. Stay healthy, stay informed, and never be afraid to advocate for your pelvic health.